Good morning, everyone. I think thank you to the MDE security team too for letting these characters in. But really appreciate everybody joining us here. March 5th would have been my dad's 105th birthday today, so I like to think about that. But we're going to begin. But I will say that Fred Banks is going to take over the meeting a little bit through my brother passed away last week. His memorial service is today, and I'm on my way to his memorial service.
Ruthanne, I'll speak for the room and say we're so sorry for your loss.
Yes. Yeah, he was a good one. For Marylanders, he was an All-American football and lacrosse player at the U.S. Naval Academy. Anyhow, good guy. Anyhow, I want to make sure we get everyone introduced who's on the commission. So Wendy, if you could please call the roll.
Okay. So can we go in the conference room first? Fred,
Sure.
You want to start?
Yeah, Fred Banks, MD.
Age before beauty. So go ahead, Fred.
Fred Banks, MD.
Ruthanne Norton.
Allie Nestat, parent advocate.
There you go. Anyone else here? Thank you. Start with Adam. Go.
Adam?
Adam Skolnick, the Maryland Multi-Housing Association Commission member.
Barbara Moore?
Barbara Moore, Mount Washington Pediatric Hospital, Clinical Director of the Lead Poisoning Program, Commission member.
Let's see. Cliff Mitchell.
Clifford Mitchell, Director of the Environmental Health Bureau, Maryland Department of Health, Commission member.
Mangela.
Good morning. Mangela Paul, nurse consultant for the Office of Child Care with Maryland State Department of Education.
And Michael.
Hi, everybody. Mike Gikniaski from the Maryland chapter of the American Academy of Pediatrics. And my condolences to you and your family, Ruth.
No, thank you.
Nadia.
Nadia Hutchinson, Baltimore Renters United.
Nicola.
Nicola Tran, Director of Full Home Energy and Repairs at State DHCD.
And Nicola, thank you for the very, very good meeting with DHCD on all of your resources recently. Really appreciate that.
Of course.
Susan.
Good morning, everybody. Sue Kleinhammer, accredited risk assessor, commission member.
Did I get all the commissioners? Are there any more commissioners here that I did not announce?
Wendy, I'm on. I came in late.
Okay, Christina, thanks for coming.
Thanks.
And if Ruthanne, can you have the rest of the individuals in the conference room introduce themselves so I can get their attendance?
We'll start maybe almost in alphabetical order, but Faye.
Faye Hansen, I am Outreach and Education Coordinator at Green and Healthy Homes Initiative.
I didn't catch your name, I'm sorry.
Faye Hansen.
Okay, thanks.
Good morning, everyone. My name is Shadia Musa, Outreach and Education Manager, Green and Healthy Homes Initiative.
Good morning, everyone. Riley Grace Rochong, family advocate attorney with the Green Healthy Homes Initiative.
Paula Montgomery, Maryland Department of the Environment.
Okay, that's everybody.
Good morning.
Thank you so much. Could we please pull up the minutes from the last meeting of February next meeting, please? Are there any emendations, objections, or the minutes?
Couple on my end. Small. My last.
Hang on one second. Wendy, do we take comments from the public on minutes or only up from commissioners?
That I don't know. I don't.
Okay, Riley, go ahead.
Sure. My last name is Rochong, R-O-S-H-O-N-G, not Roshon, R-A-S-H-O-N.
I'm so sorry.
No worries.
Oh, gosh.
That's a small thing. Under Delegate Rosenberg's bills for lead reduction, this says it would modify the requirements for MDE to issue a notice of defect for lead That's slightly inaccurate. It would modify the requirements for a landlord to comply with a notice of an EBL level.
Okay.
Let me know when you want me to move forward.
No, go ahead. It's being recorded, so I'll just make the changes after the meeting so I can thoroughly go through. I don't want to miss anything, so you can go ahead.
Under concerns for expedited wrongful detainer, the last point about Sam McGranahan should be moved to the prior point, and under the lead and copper rule update and environmental grants, I will not be filing the amicus brief on behalf of the organization. It's likely going to be either Wes or someone from the Harvard Environmental Advocacy Clinic. That's all I got.
Okay, thank you very much. Anybody else?
Any other comments to the minutes? Amending, which will be done post-meeting, the comments made by Ms. Rochon. All in favor? Well, sorry,
Aye.
motion to adopt the minutes.
I make a motion to adopt the minutes.
Second.
All right, all in favor? Oh,
Aye.
Aye.
aye. All right, adopted unanimously. Thank you. We are going to get to a couple of things here. I want to definitely thank Bay Hansen and Wes Stewart for their assistance on this, and also the commission input on our establishment of our committees. Wendy is going to put up the link and then share the link after the meeting. But we, after discussion, have laid out the committee structure. Housing and health policy are going to go into the policy framework. But the health policy of that will cover testing and screening strategies, housing policy, and this is not limited to. Housing policy will include the issues around the inspection standards. We can talk about that and move it to training and accreditation if you'd like, but I think it's more policy that we're discussing around some of the standards at this point. There is a community engagement, including the resource map. You'll hear from Shadia and Bay Hansen, who've done an amazing job on that. And they'll give you a draft of talking about where they are in that draft. Training and accreditation, which will include the contractor and workforce development, resource development, which will include the discussion around the creation of a lead and healthy homes fund, philanthropic and fund that would work in alignment, and then legislative committee. Under the ad hoc committees that have been discussed, one is a recommendation on rural community strategies for MDH, recommending that that gets folded into the health policy committee, CLIF, and then the committee to research and discuss the implementation of a lead insurance bond or bond fund for inspectors. I'm suggesting goes in to the housing policy. We will share the sign up. People did a sign up during the initial survey, but given the further discussion, you may wish to move or change. Once the commission members sign up, then that committee may see outside members to the subcommittees for input. Any comment in the room first on the placement of the bond and insurance or anything like that, Fred?
Nope.
Okay. Ally? No. Okay. We have Susan has her hand up.
No, sorry, that was just to say I approve the minutes.
Okay, thank you. You want to take your hand down there? Dr.
Michael Igniowski's hands up.
There you go. Thank you.
I just say I can go on the health policy committee.
Thank you very much. And you can go online too if you'd like. I know Nadia had signed up previously. Nadia, community engagement, assume you want to stay there. But if you want to move to any of these others, you know, that I'm just giving an example. So if there's others, LED.
Um,
MARY.
I can't remember. I know that I wanted to stay with what I did. I think it was testing.
Yeah, it's okay. That'll be on the health policy.
Yes.
Yes. So, Wendy, just for the note, Ali wants to be on the health policy. I think Barbara Moore as well. Susan, is that a new hand raise or
Yes.
still?
Yes, it is. Yes, thank you, Ruthanne. I'm assuming that Chairman, that commission members can be on multiple subcommittees?
It can be on every single committee should you choose to accept.
Appreciate that. Thank you.
Okay. All right. So what I'm going to ask is that we would have, if you would try to sign up today or by the end of the week, at the end of the week, Wendy and I will send out the standing committees with a charge, which the committees can amend when they receive that charge. And then we would like to start making recommendations for the process to add public members. We will do that, and we will ask that we start committee meetings within the next couple of weeks. And I'm going to volunteer my office to help Wendy on the scheduling of those meetings to make sure. And Christina's saying she'd like to stay on community engagement. Cliff Mitchell, are you good with putting rural community strategies into the health policy as an ad hoc within that group?
I think that it is a brilliant suggestion, unparalleledly brilliant.
Okay, there you go. Fantastic. Love the energy. No more Red Bulls for Cliff. That right. Okay.
I heard that.
So
Cliff, I needed my hip waders for that, but that's a whole separate issue.
yeah, that's right. So given that, we are going to move to 3 kind of discussion points, and one is we are going to move to the discussion for legislation. And then Cliff, I'd like you to say more about the thought process on rural community strategy. And then Fred, if we could get to the discussion on the bond fund. I know we wanted to talk about that today. So Adam, anything as the commissioner you want to open up on legislation? Then I brought Riley and Wes is on the line and others.
One, I want to say to GHHI, thanks for adding your tracking list to the agenda. That makes life a lot easier for sure.
Pull that up, it'd be great.
Good. So heading through real quick, I mean, just updates, HB 196 and SB 570,
Hang tight. Let's get the tracking list up if we can.
Yep, let me get it. As soon as, let's see.
Apologies for the delay here, folks.
Legislation, here we go. Okay, can you guys see that?
Yeah, can I just say before we get to the state legislation, the Baltimore Renters United and many partners and supporters, there was that they brought forth to the city council, and there was a hearing on Odette Ramos's proposal for Safer Homes Now. Extraordinarily strong turnout, and part of the issues that came up there that the city council will be looking at is the licensure in the city of Baltimore of rental property owners who should not be receiving a license because they are not in compliance or registered with the Maryland Lead Risk Reduction in Housing Law. So I know that our organization is scheduling a meeting to meet with the new DHCD commissioner and staff on that issue to see if we can be moving that in a better alignment. But I just wanted to give Nadia or Riley a chance to say quickly anything about that bill, or Adam. I know Kathy Howard represented MMHA, but just to let folks know.
I'll quickly reiterate, the hearing went great. I think there was a wonderful turnout. At this point, the main posture is there's consideration for various amendments to be introduced. We're still finalizing exactly what those are going to be looking like, but that's an ongoing conversation. So we will keep you all updated.
Okay. Adam or Nadia? Any comments?
Yeah, I mean, my comment on a lot of these I call them landlord tenant bills is that I mean, it's important. It's supremely important. I don't know how relevant to the lead commission all of them are, but if anybody ever wants to talk about them, I'm happy to have the dialogue anytime.
I think there is pretty uniform agreement that we need to make sure that to receive a license in Baltimore City, you have to be by the statute in Baltimore.
100%. 100% agreement. There's no doubt.
I think we're in agreement on that. Nadia, did you want to say anything else? I thought Baltimore Renters United did a great job.
Yeah, I just wanted to share that I feel like this bill and like kind of package of bills was really community led. There was a lot of interest from renters and folks that have had really bad renter experiences that really helped to shape this bill. And so just want to emphasize how important it is when community has the opportunity to help shape bills and legislation that will meaningfully impact themselves.
Yeah, and I would say the representation of renters for the city of Baltimore that were at the hearing came from literally every community across the city. So it was pretty stunning. We will keep you updated on that as it relates to the issues of lead for certain, but they are suffering in the city from a lot of out-of-state and international landlords who have never even seen the properties that they own. Let me move to state legislation. Adam, you were starting.
So HB 196 and SB 570, the baby food bill, the toxic heavy metal bill is still in committee, so it's still pending. HB 252 and SB 203, that's I'll call it Fred's bill. That passed on third reader out of the House yesterday, so and it's already passed third reader in the Senate, so that's going to end up being passed by the legislature, in my humble opinion. HB 315 and 335, again, much more of an L&T bill. I'm not 100% sure why the commission would be worried about this, but happy to talk about it if anybody has any questions anytime. The HB 1067 and SB 181, the lead-based ammunition bill is still in committee pending. HB 1547 and SB 873, that's the bill that basically gets rid of the requirement for the environmental investigation. That is a hearing in ECM on the 13th. It had its Senate hearing yesterday. HB 1549 and SB 872, that's the one that on the independent living, that's and the rental dwelling unit, and makes the shared spaces one that we talked about last month. Awaiting hearing in ECM and waiting. It's still in committee, basically, is the best way to put it. HB 59, the wrongful detainer bill, still waiting in committee. And the landlord SB 635, the right of entry for landlords, MMHA and GHHI have come to an agreement on an amendment that would strike from that bill any reference, or it would actually exclude the right of entry from the environmental article. So we're in agreement on that. So we'll see where that goes. That's my quick update.
Yeah, so I think my take is the one that expands the two of significant note for this commission is one bill would expand coverage of the lead risk reduction and housing law to single room dwelling units that do provide the definition of a real dwelling unit. This is an issue that we have seen really explode in terms of people not being able to afford housing, and more families that we are serving living in single room dwelling units. And then the other, for which there is, I think, some disagreement between property owners and advocates, is around the modified risk reduction in housing law, changes that were made in 2019, changes that were made today. I'm just going to ask Riley to kind of empirically explain that. And then I know Adam has a concern that it undoes some inspections, and the advocates have a different opinion, but just to let the commission hear that.
Sure. So the way that HB 1547's SB 873 is drafted is not to remove the requirement that MDE conduct an environmental investigation. That is still required under Maryland Environment Article 6-305, regardless of this bill. So that is still going to be conducted by the Maryland Department of the Environment. We have included information about that more specifically in our written testimony. But beyond that, specifically what this does is it alters the conditions under which a landlord must respond to a notice of an EBL level that the department should be sending under current law whenever someone tests positive, or whenever a person at risk on a pre-1978 rental property tests positive for an EBL 3.5 or higher. It doesn't get rid of the environmental investigation.
Okay, so but functionally, the way the bill is drafted, it would require a landlord to, I mean, a modified risk reduction would automatically be kicked in, and then the cost borne by the landlord when you find out after the fact that that child with an EBL was poisoned by some other source, whatever that source is, be it cinnamon or anything else, you've still now incurred the cost from the landlord, which is why in 19, the combination was that there was an EBL and the environmental investigation said that it was indeed the property, which, again, if it's the property, the landlord should abide by the law and has to abide by the law. And the way the bill is drafted currently, it still would make a property owner, a landlord, go through all those hoops, even though it wasn't the responsibility of the property, which is a concern. So if we can find a middle ground and something that works, that would be great. But, for now, we're opposed.
Yeah, I understand that, and we will sit down and have a discussion on that for sure. I'd like to get feedback from the commission on that. Susan, you have your hand up. Any other hands up, Wendy, in addition?
No, Susan's hands, go ahead.
Thank you.
That's the
Thank you
only
so
one.
much. I couldn't agree more with Adam. Well spoken, Adam. From the streets of Baltimore, talking to landlords, the cost of doing modified risk reduction is upward of $10,000 to $15,000. And so therefore, then if you have a child with an elevated blood level, it is very important to make sure that it's coming from that house. If there is no chipping, peeling paint with an elevated blood level child, I strongly encourage that it not be solely upon the landlord to be responsible for those payments where that might not be the primary source of exposure.
Let me just say, under the traditional modified risk reduction, what happens is a family would file a notice of defect which covers elevated blood lead levels or housing conditions. What that compels the owner to do is for the owner to go and look at the unit and see, is there chipping, peeling, flaking paint? Are there other housing related hazards that may be contributing? And the owner, under the traditional implementation of the modified risk reduction, does not have owners adjudicating lead in water, does not have owners adjudicating lead in soil, does not have owners adjudicating lead in pottery or spices. So the only purview and the only thing this would do is to have a timely and quicker response to what potentially could be imminently harming children. And I want to remind this commission, about a year and a half ago, we had a situation that the lack of timeliness, not just in general across the board from the public health department and others, the lack of timeliness led to a child whose family moved into a unit with a 0 blood lead level and that blood lead level resulted in 97 micrograms per deciliter, and the sibling went from 0 to 21. We currently have children in the state of Maryland with elevated blood lead levels who have the blood lead level determination made and are awaiting an inspection from the department, which is important, but not having to compel owners to do the normal modified risk reduction means that the family is waiting when they could be potentially getting the unit clean and repairing chipping, peeling, flaking paint and protecting the brains and lives of these kids who then languishing is not an option. And so this is certainly worth a public debate on how the legislature will view that. But the risk factor is the time. The risk factor is the time. Now, if we all want to get busy and get the Maryland Department of the Environment more money to get more inspectors who can respond immediately when there is a blood lead level to every home where there is a blood lead level, then we would have a better alternative, in my personal view, right? So I do want people to understand the import of our duty as a commission and as a state to protect the lives of our young children. And that is what has been raised here. This didn't come about because people were just thinking about what legislation. This came about because children are languishing in time and owners are doing nothing. Some owners are doing nothing because they're waiting for the Maryland Department of the Environment to tell them there's a problem. We already know there's a problem, and the owner should be a good partner to go and check, and it would not, under any circumstance, to be clear, compel that owner to take spices out of the cabinet or to clean up the soil or to try to fix the lead pipes. The Maryland Lead Risk Reduction to Housing Law and the Modified Risk Reduction deals only with paint. Christina?
Yep, so I understand both sides. I appreciate the information. Is there a proposed amendment from Adam or anyone else that would speak to the urgency and the importance of keeping everyone safe, but also addressing their concerns about the financial
It is the burden of the owner. Let me just say, Christina, under law, the way the law is written, if there's a rental property and there is chipping, peeling, flaking paint in that rental property, that is the financial burden of the owner who's putting that product on the market. It is not the financial burden of the tenant who's renting.
No, I think I understood that part. I think what they were saying is that it may not be the paint that's the cause of it. So I understand what you're saying. I was just asking if there was an amendment proposed.
100%.
I was just wondering what that amendment would be as a commissioner to listen to. Yeah.
100% understand that. Adam, you want to,
I don't have an amendment at the moment, but let's also be clear. No one is arguing that if there is chipping, flaking, or peeling paint, that the landlord has to do something. They need to and have to, right? The issue is when there isn't chipping, flaking, and peeling paint. Okay, so there's no chipping. So the landlord does a visual, or even pays somebody to do a visual, hypothetically, or even pays to do just dust testing to verify that there's no lead dust in the property. But based on the way this bill is drafted, the full modified risk reduction kicks in. And that's the concern and the issue. And listen, with all due respect to the Department of the Environment, that's their job, right? It's the department's job to do these inspections when there's an EBL, and to somehow, and I know, Ruthanne, I don't know that this is your intent, but it is the inference that somehow we should place that burden on rental property owners and let the department off the hook because they, in quotes, don't have enough inspectors. That's an unfair burden. This is what the government signed up for when these bills were passed and these laws were implemented. And that's what the department should be doing. I won't argue if we want to have a dialogue about general funding more money to the department to do these inspections, then we should all be having that dialogue in Annapolis. I couldn't agree more. But
100%.
but consistently, that onus has been placed on rental property owners. And when plus or minus in the last surveillance from 2023, 60% of kids, when the department was actually able to figure out the source and then tied it back to housing, when 60% of those kids are in owner-occupied housing, and we have no laws on the book to do anything about owner-occupied, and 40% are from rental housing, to continue to place more onus on rental housing providers seems patently unfair.
Hang tight. Thank you, Adam. I do want to be clear, this law would not require rental property owners to take on the burden for, I understand the point you're trying to make, but just for people to be clear here who are listening from the public, this bill does not ask rental property owners to take on any financial burden or any actions related to owner occupied property. I was not saying that we want to let the department on or off the hook. So and you are correct, and I appreciate the opportunity to clarify that. I do think what is at debate here is a provision that that rental property owners lobby was able to put into the bill when the Maryland Department of the Environment, when the state of Maryland in 2019, under Governor Hogan, was trying to lower the blood lead level to 3.5, and owners were able to negotiate something that advocates today and those who are providing services and working directly with families believe ended up being effectively an inadvertent, if you want to call it, but loophole that caused owners to take no action at all on chipping paint or on anything that is clearly housing related. And so what is at debate here is whether or not we should go back to the standard prior, but attached to the threshold level today, 3.5, and enact the general modified risk reduction review and action. And yes, indeed, it would put the burden of cost of remediating those things within that, if they are found, if and only if they are found, that the owner would have to repair and would have to pay for. I believe, Dr. Ikonowski, you are next.
Thank you.
And, I screw up your name every time, so I apologize.
You got it right. You got it right.
Okay, that's the first time. There you go.
I just want to make sure that the kids don't get lost in the shuffle here. A child who has a lead level of 97 is irreversibly damaged by that. And there is no amount of money that is going to recover that child's neurological functioning or whatever injury he may have suffered from that. So you have to keep that cost in mind at all times too. Lead paint is still the leading cause of lead exposure for children. Yes, there are others. The cinnamon outbreak that happened a year or two ago is an excellent illustration that there are other sources besides the lead paint. I think it's imperative to not only look for the visible flaking paint, but also lead dust. Children crawling around on the floor, you can have more microscopic levels of flaking and chipping, if you will, that end up in the dust in the house. kids who are on the floor crawling around, putting their hands in their mouth, will get exposed to lead that may not be visibly flaking or peeling. So it is incumbent to protect the children from exposure to lead. You can't undo damage that's been done once they've been exposed. And that needs to be kept first and foremost above everything else. You know, there's no treatment that will undo damage that's been done by lead, and there is no safe level of lead for a child's developing brain. So I think it's important to always keep that in mind when we're dealing with lead issues. I can't do anything about the cost of what lead remediation is in a house. I can't do anything about how many inspectors the Department of Environment has to conduct these evaluations, but that needs to be done on an urgent basis, especially as the lead levels get higher and higher, to find out exactly where the lead is coming from. If there's lead in the house, it should be removed. You know, and I apologize that costs money to the owners of the properties, but you know, in order to protect the children, they need to be kept from being exposed to lead. You know, you can't place the burden on the children to say, well, don't eat the lead chips. You know, kids are going to put their hands in their mouth. They have been doing that since children were first around. So, you know, you're not going to change child's behavior. And it's important to do everything we can to protect children from the exposure to lead. There's no substitute for that in treating lead poisoning.
Yeah. Thank you, Doctor. And let me just say, you know, we will all look at all of the proposed amendments and different things. The legislature at the end will do that, but we can all look at them and weigh in. You know, I think the worst case scenario here is with that if owners revert back to the standard of the modified risk reduction and they walk in and even if it's the cinnamon that poisoned the kid, but that compels them to go look at the unit and there's shipping paint, let's think about that as prevention, and early maintenance as well, you know. So we've got kids' lives at risk here. Ms. Kleinhammer?
Thanks again. Look, I don't think there's anybody on this commission who wants a child to be lead poisoned unnecessarily. Hands down. However, when the one thing that nobody talks about that is not the responsibility of property owners is the cleanliness of the tenants. And I don't know why we try to hide from that, because oftentimes cleaning itself would remediate the excessive. Excuse me, I'm sorry. I was just like to finish.
No, I'm going to actually be very mindful here.
Oh, God. I don't understand why I get interrupted, Chair. Why can't I have my point on the record that cleaning is just as important of an intervention? If there is no chipping paint, then cleaning is so important. I live in a house. I've got tons of lead-based paint, and I keep a clean house. If you have paint that is lead and you have a clean house, the chances of elevated blood lead levels dramatically drop. Where's the science that this onus, and I'm not even a rental property owner. I just feel that the pendulum has swung so far off to the extreme on landlords that I just want the record to reflect that. Thank you.
Okay. I also want to be mindful that I don't believe, well, I can say that I'm concerned that stating that parents who may keep unkept houses is the reason that kids get poisoned. I don't think the data and studies show that. And it is often used, it's a sensitive issue for many communities. And I want to just be sensitive that the commission is not saying that families' upkeep of housing is the issue here. Nadia?
Yeah, just to your last piece on upkeep of housing, I think that also there's just such a big education gap, and I'm really excited for the subcommittee to be working on what community education looks like. I recently was with a friend who was trying to insulate, like on their own DIY, insulate their house, and they kicked up so much lead dust and had no idea. And I was like, yeah, I think that this might be a problem. Pregnant, about to have a baby, was just trying to like make sure their house was cozy. And so I do think that sometimes folks make their house quite messy when they're doing like DIY home fixer-upper things because of how expensive contractors are. And those contractors know how to lead abate. And so I think that to what folks have been saying around cost effectiveness and also just education more generally. And I think that there have been some really good points that have been brought up around like homeowners and how do we also do education to homeowners on like what types of repairs and things that they should be cognizant of.
100%, 100%. I'm going to depart, but Mr. Banks will take over. And I want to thank our presenters. Apologies for not being here for the presentation of good work. Cliff, when the lead resource tracker comes up, I'll ask you to manage that and discussion, and appreciate Day and Shadia for that. And Fred, you got it.
Okay.
Thank you.
Travel well, Ruthanne.
Thank you, Ruthanne. Best wishes.
All right, Adam, any more on legislative?
Yes, sir.
All right, moving on to recommendations on rural community strategies for MDH.
Yeah, the answer.
Doc, you have anything on that? Dr. Mitchell?
Thanks, Chair. We are very early in the process, but I think that there are a couple of things that we are looking to the commission for some assistance in, not necessarily now, but to think about. Number one is how do we increase the number of folks who are qualified to do renovation, repair, painting, and carry out the RRP rule in rural communities? And that feels like that is probably a collaboration with MDE and others to think about that strategy. Another question is how do we, knowing that testing rates tend to be lower in some of the rural communities, how do we increase awareness amongst both parents and providers about the importance and value of testing? And a lot of that has to do, I think, with making sure we meet people where they are. And since figuring out what communication strategies and channels are important, that is something that we really need some help with and some input on. And then the other thing I would say is just as we are missing in many cases some of the infrastructure for both lead testing and for lead abatement in those communities, we also don't have as much of a handle on some of the non-housing related potential risk factors, such as target practice, shooting, and other kinds of things that can lead to lead exposure, we know, in the population. So there are a lot of questions, and a lot of it, we are very early in the process of understanding what exactly the rural health transformation strategy is going to look like from the department's point of view and healthcare's point of view. So I think in some ways it's a very good time for us to be thinking about how, as organizations and as a commission, we might position ourselves to take advantage of whatever those changes are and have input into those changes. That's, I think, my initial thought or combination of thoughts. And I'm happy to have input any kind of ways that you feel it would be helpful. But this feels like we have been very, very focused appropriately on the large number of children with lead poisoning in our urban centers, and in our older communities. But especially if you look at the data for places like Cumberland, and other parts of Allegheny and Washington counties, and then the lower shore, the eastern shore, we have significant numbers, not huge numbers, but significant numbers of children with lead exposures. And it's frankly been a lot more difficult to provide the kind of resources and help that I think the middle of the state have come to appreciate. And it's not saying we're perfect in the middle of the state by any means, but from an equity point of view, we don't want to leave any child behind. And that, I totally agree with the governor that there's no reason for us to be less concerned about the children living in rural communities than in children living in our urban communities.
Hey, Doc, you have a question in the room from Fred Banks?
Well, if the chair feels that he should recognize himself, who am I to stand in that way?
So it's not so much of a question, but we've had numerous discussions about this. Going back to House Bill 1067, one of the questions we got with that lead and ammunition was the prevalence of lead poisoning where ammunition was caused. We really didn't have any data on this. It's more on the adult side that we see occupational exposure.
Yeah.
So we're really looking to kind of work with DNR to develop a partnership to figure out if this is something that affects our children. On another note, Paul has worked on the RFP. I'm sure you're aware, and we're trying to build out clusters of outreach into the RFP that addresses some of the issues that you brought up. So you guys should look out for that.
And you know that I am delighted to provide feedback, input, and assistance with respect to all of that activity. And I will say, with respect to DNR, our Office of Food Protection, as you probably know, work with you and with the Department of Natural Resources on a guide related to lead shot in wild game. And that is something that I think, again, is the kind of partnership that we want to see. I do think that thinking about the value that all of us have with community-based organizations, we have not had as much success in all cases looking at community-based organizations in rural communities. And I think that's an area where if there's any networking amongst the CBOs and the community-based organizations in the state, in terms of both nonprofits and healthcare institutions, that's something we also, I think, need to do better.
It's Ruthanne. I'm joining from the car, but just to say that from the Western Maryland outreach experience, we were able to garner a number of organizations there that, and Bay actually, Hanson, who's in the room and at MDE, was on that effort. But we certainly can connect MDH with those community organizations, because in those houses, there's a lot of lead paint as a result of the flooding. And so there is a network that's begun to get established there in that part of the state. There is obviously through Dorchester and others, some pretty strong ties on the Eastern Shore, but just we will certainly contribute the connections to those organizations for Western Maryland.
Now, I really appreciate that, Ruthanne, and Theo Williams and Nancy Servetus are both on the call. And they will be happy to touch base with Bay and exploit her mercilessly for those connections.
Yeah. Question from the room.
Just a comment. When we were researching in advance of our testimony in favor of House Bill 1067 and Senate Bill 181, we did go through a lot of the literature. One of the most relevant studies that we found was a 2009 study out of the University of North Dakota School of Medicine from Kornetzer et al. It specifically looked at donated game meat given to a state food pantry program. And it was able to find out of 100 randomly selected sampled packages of meat, metal fragments in 59 out of the 100. And then they tested 5 of those and they were able to all test positive for lead. So there is at least this specific study, because I know that opponents sometimes bring up whether or not there are specific studies showing that this is an issue. That's one that we found that looked at that specifically. And then especially for kids who eat from those kind of food pantry programs, I know that we have similar programs in Maryland, like the NRA's, I can't remember the name, but I know that they have one that's active here. So if you want, we can send you those materials.
Appreciate it.
Yeah, no, thanks for that.
Yep, no worries.
Any other questions, comments?
The
Okay.
only other thing I will say, Fred, is this is the beginning of a long engagement. This process is not going to be fast. And I think we're talking about fundamentally altering, in the case of the department, how we view healthcare and public health in large chunks geographically of the state. And I don't think any of that is going to happen quickly. But that's the reason I think it's good for us to be thinking about how to position ourselves in that regard.
Okay. All right. Thank you. Moving on to the Committee on Research to discuss the lead insurance bond. We've gotten a lot of good momentum in the General Assembly moving us forward. Adam and I have spoken about some ideas. I'm looking forward to people joining the Housing Policy Committee to help us work through, if this passes, putting together regulations to regulate this. Outside of that, any questions, comments? Susan?
Fred, thanks so much, Fred. My only concern is, is the sequencing of how things occur. Should not the issues at hand about availability and cost be discussed and have a committee, some input before the bill even is passed? Because once the bill is passed, then our hands are, maybe I'm wrong, are more tied. It just doesn't seem like it's in the right sequence. Thank you.
Fred, let me jump in. So I talked to Fred and the government affairs folks at the department, and they really want to promulgate this through regs. They want to get the bill passed and then deal with the regs. So, Fred, I think all we'll ask is when you guys are working on regs that we get input, which I know you and you've agreed to. So it should be all right.
Yep. Okay. Any other questions, comments? Okay. Regarding the commission review on the input for the annual report, I believe all the commissioners should have received a copy of the report. I do apologize for the delay. That was kind of on me. So hopefully everybody has gotten it. And any comments, please submit them to the chair and Wendy, and then we'll get that out to the rest of the commission once it's approved through the process. But I'm willing to hear any discussion or question about the commission report if we have any. Okay. All right. Updates on issues. 28th Street Bridge. Is this me? It is me. I'll tell you what I know. But this is a joint investigation by MDE. As far as the lead program is concerned, we went out on an initial complaint that came from Blue Water Baltimore that identified paint chips on the 28th Street Bridge. The same day the complaint came in, we sent out an inspector to take samples. got those samples examined and tested. They were, I want to say, over 100 times the amount for acceptable lead. And so we passed it on to both the water administration here and also solid waste. Solid waste actually issued the complaint to the city, and in the process of getting that worked through now. As a result, Blue Water Baltimore identified paint chips on 2 other bridges. One was the Arbutus over 95 overpass. I believe the second one was might have been Guilford Avenue Bridge. You got the
From Blue. There's somebody from that organization on them.
okay. All right, is Blue Water Baltimore here?
Yeah, hi, can you all hear me?
Yep, we hear you.
Hi, everybody. My name is Alice Volpetta. I'm the Baltimore Harbor Waterkeeper with Blue Water Baltimore. So we're up to 3 confirmed locations with bridges shedding lead paint at this point, and then there's one additional one where we have a sample out that's currently being processed, and then my team is going to investigate an additional bridge today. So the locations of the bridges where we know there's lead paint is at the 28th Street overpass, the I-95 overpass at Potomac Avenue and Arbutus Avenue, so that's over in Halethorpe in Baltimore County, the Orleans Street overpass at Guilford Avenue and Bath Street. And then the sample that we have out to the lab is the I-83 Falls Road exit, where Clipper Mill Road and Falls Road meet. And then we have another one my team is going to investigate today. It's the Howard Street overpass down near the Jones Falls, like near Bikemore. So we've had really high levels of lead and also confirmation of PCB contamination in all of those samples that we've had tested so far.
Dr. Mitchell?
So, back when I was practicing occupational medicine, we regularly saw construction workers who were doing bridge work, and that was sandblasting or blasting of any kind, scraping, peeling, anything involving bridge work. You could guarantee that there was lead paint in those bridges. So I guess my question is, and I admit I sort of have not been close to this, between Maryland Occupational Safety and Health and MDOT, it feels as though, A, we ought to assume that any bridge with paint on it has lead in it. B, that whatever the permit process is, I assume is somebody is issuing a permit for that work. And it felt like for a while there was, and I still think it is true, that MOSH pays very close attention to these from an occupational point of view. But it feels as though over the years, we have sort of gotten a disconnect between the work that the Department of Labor and MOSH do with respect to certification, whoever is the permitting authority for these and the contracting authority, and the work that gets done. And a lot of this, I'm wondering if it goes back to it, who is the agency that is letting the contract for these, and is lead protection built into those contracts from the outset? Because actually, frankly, there's no bridge in Maryland that is likely to be lead-free at this point. And because these are big contracts, I'm assuming that somebody is looking at the contract language fairly carefully. But I might be wrong about that.
Okay. All right.
So yeah, so I guess the action item there, Fred, is maybe it's worth a conversation with MDOT and the Department of Labor and MOSH about whether or not RRP and lead identification are built into contracts.
Yep. So we do get notifications when there's lead abatement on bridges that occur. but these were definitely not worked on. That's why they were passed on the solid waste. I got a question, Alice. Do you guys plan to look at any other bridges in the state?
So right now, we've basically sent out a call to our membership to keep an eye out for additional paint flakes near overpass bridges like this, because that's where we've been seeing them. And then if we get reports about them, we're planning on going out to test them. Yeah.
Okay. Okay. Susan?
Thank you, Fred, so much. I wondered, you know, we have now from EPA safe levels of lead and dust. We don't have a safe level of lead in paint. So I was wondering, Blue Ocean, if, you know, if you had these readings and you didn't find lead, but you had high negative readings, does that give the people who are going to do repairs to the bridges the ability to sandblast?
I'm not sure what you mean by high negative readings.
Well, I'm okay. Thank you. Well, how are you doing it? You're doing paint chip sampling?
Yes.
Okay. Well, but even paint chip sampling off the ground or off the bridge?
So the issue with these bridges is that they're shedding their paint, so they're not being actively worked on. The paint is popping off of the bridges, and then we're recovering those paint chips.
Right, you're recovering the paint chips, but do you know that you're getting a full paint chip by not taking it off of the bridge itself? And that's a different question, but I mean, to just take a paint chip off the ground may not represent the first primer.
Yes.
So then, if you're not taking your paint chip sample off the bridge, could it be that you're leaving the lead primer behind and reporting it as it not being lead, number one? Number two, if there is no safe amount of lead in paint, and certainly if somebody could correct me on that, which I don't believe EPA has given us a safe amount, even if you get a negative reading, but it's a high negative reading, does that give the right to the people who are going to make repairs to that bridge be able to do something like open sanding, which then could create a hazard because there is no safe amount of lead in paint?
Okay. All right. Any other questions, comments? All right, I will move on to, unless there's any other comments about the 28th Street Bridge. There's a more recently today, there is Channel 11 did a story on the bridge. So I can send the link out to the group.
I'll do that.
Okay, I was going to send the link out to the group. Alice, you got something else for us?
Yep, just really quickly, I wanted to mention the fact that we initially got the report about the 28th Street Bridge, and we did the initial sampling on February 4th. And as of earlier this week, at least, I'm not sure about the current status of today, but as of earlier this week, that the area still hasn't been cleaned up. So Baltimore City has had the directive from Maryland Department of the Environment to completely clean the area and to basically sandblast that bridge to prevent further paint chipping from falling down to the ground. And that work hasn't been done yet. So I did see a recent press conference, I believe, that Mayor Scott held with the intention of going out and cleaning up the area. But as of earlier this week, it hasn't happened yet.
Okay. All right. Wes, do you have anything for lead and copper rule?
Yes, I do. If Wendy's able to pull that up. Ruthanne, our chair asked that we present an update on the lead and copper rule improvements and make the commission aware of some significant developments in that area. So next slide. So as the commission's aware, the EPA released a strategy in 2022 looking more comprehensive at all the sources of lead in the environment and developing strategies to remediate multiple exposures beyond just lead paint. Next slide. And as part of that, they also have been working to update the lead and copper rule. Original lead and copper rule was released in 1991. It was updated in 2021. And more significantly to be aware of is the lead and copper rule improvements regulation. The final rule was released in October 2024. And that the majority of that really supersedes the original copper rule and also the 2021 revision. So very significant release in October 2024. Next slide. And what the changes were made was that the action level most significantly was reduced from 15 to 10 parts per billion for sampling by water systems in terms of action levels and having to do additional remediation, having to do additional corrosion controls. It also set a deadline of November 2027 for all water systems to submit their lead service line replacement plans, and also then gave them 10 years beyond that deadline. So from plans are due by 2027, and then by 2037, the new revisions to lead and copper rule require that lead service lines be replaced within 10 years. So just to follow that chronology, water systems were conducting inventory. That was due in October. They have then essentially 3 years to develop their lead service line replacement plans, and then remove and replace lead service lines by 10 years. So this is a really significant development. This was triggered not only by the desire to reduce lead in water, reduce other sources, but also due to the $15 billion in infrastructure bill investments to actually fund that initiative. So next slide. One thing to be aware of in Maryland is that as jurisdictions and water systems are filing their lead service line replacement plans, it may be beneficial for this commission, as they did with lead and water in schools. We had an excellent presentation by MDE Water Division about lead and water in schools, but also may be helpful to look at what are the inventories showing, what are the plans that are being submitted to MDE, but that may be a future point of interest for this commission. But for the smaller systems, for systems that were concerned about being able to meet that 10-year deadline, there is an ability for certain systems to also get a deferral to extend that. So just to be aware of that, comes up from jurisdictions. There is an ability to ask for a deferral depending on whether your jurisdiction has a very high proportion and propensity of lead service lines. So next slide. So one thing to be aware of is that final rule was issued and went into effect in October. However, a number of lawsuits have been filed. Most significantly, Ruthanne wanted you to be aware of that the 10-year deadline there's an effort to actually upend that, and that's been filed by the American Water Works Association, who is suing the EPA over the lead and copper rule improvements rule. They're joined by other stakeholders, including the Chamber of Commerce, and that is before the U.S. Court of Appeals for the District of Columbia. The brief has just been filed by the EPA within the last several weeks, and the EPA has said that it is feasible for water systems to be able to meet the 10-year rule to replace lead service lines. So again, another significant source of lead in our environment. The EPA says that that is doable, it's feasible, and they also have revised the estimate of the number of service lines, previously estimated to be about 6 million, down to 4 million, based on the inventories, based on the reports that are being filed with the states and being shared with the EPA. Again, EPA's position is the 10-year rule is feasible. There also are less service lines than originally projected and estimated, down to about 4 million in the US. The main objections from the industry are that it's just too short a period of time. They don't have access and control to be able to go in and remove the lead service lines. But again, that is not the EPA's position, which we support. So that is before the U.S. Court of Appeals for the DC Circuit. There'll be in the upcoming months, there'll be a hearing on that. And GHHI, a number of public health agencies, several states, and also other advocacy groups have filed and are filing amicus briefs. We are doing so in cooperation with the Harvard Environmental Law Clinic in support of the EPA and the lead and copper rule improvements rule. So Ruthanne thought it was important for you to know that. Again, next slide, $15 billion has been allocated to help fund the lead service line replacement. That's in addition to all of these other funds that have been there for a period of time, especially the state revolving loan fund. So there are a number of financial resources for water systems, but again, most significantly, really accelerating the pace of lead service lines is $15 billion investment from Congress to help pay for that. So Fred, I don't know if you have anything else to add, or if we wanted to have the water division at some point But just to be aware, that is an important deadline for Maryland jurisdictions and water systems to get their plans in by 2027 and remediate by at latest 2037 lead service lines in Maryland.
Thanks, Wes. Mangela, I know there was an email that came out, I believe it was last week, regarding one of the daycare centers, and I know you've been working with Greg and Water. Were you able to resolve the service line issue in the daycare centers?
Not yet. I sent email, been receiving for response. It's more than, like, it's couple of weeks. And then something happened with the other program that happened last week, and I just received response today. While I really, Mr. Stewart's report and others, it's encouraging, but I'm still concerned. We change the words with let safe and let free. Especially with the early education programs, when these young children are there, when that water is being used, whether it is within the EPA recommended level or MDE recommended level, any level in water or any level in the environment, when the children continue to consume the water or inhale that air, it's dangerous to those young children. And I'm so happy that there's $15 billion for pipe replacement. I would respectfully and humbly request this commission to allot some money to the childcare programs when this rule is being implemented, when the 20% installment of childcare programs are going to be tested for lead in water. And when those programs are found to be with any level of lead, leave alone 15 per billion or 10 per billion in its sampling of water, to remediate that water source, not the main line, but the line that's coming from the main line to the program. It's a simple flushing, and they just need some recommendation and some financial support for someone to do that flushing, and also if it's necessary to change the faucets. Childcare programs do not really have that resource or additional funding, but imposing the EPA rule of lead and copper rule for testing that water and spending money on water testing, but not necessarily giving the support to the early education program is a bit concerning. And I would like to bring that concern to the commission. And I'm humbly requesting the commission to recommend for separate, assigning or allotting separate funding for early education program within MSDE to remediate those issues when it's found out or when the report we receive. Thank you.
Thanks, Mangela. Any other comments, questions?
I commented in the chat. I concur with Manjula.
Okay, thanks, Christina. Dr. Mialski?
Yeah, I would agree with Mangela as well, and I would make the point that the younger the child, the more potential for damage from lead is. The less developed the brain, the more lead can interfere with further development of the brain. So I think it's important to look at early child development centers as a place to do the lead pipe remediation as well.
Okay, Susan?
Hey, Fred, thanks so much. This is not, I certainly support what Mangela said. This is not on that particular topic. But having just received the commission report to the governor last night, I really have not had a chance to go through everything. And I just wondered, because it's from the commission, did any commissioner have input into this report?
I assume that's what we're doing after we read it.
I think that's what the point of you guys getting a copy.
Oh, okay. So so that this is not the final draft.
No.
Okay, thank you. Thank you. I appreciate that.
Okay. All right, any other questions about lead and copper? Mangela, I'll reach out to Christina. I think you've been in contact with her in water and Ardito. And maybe we can put together a meeting to see if we can work this out, okay?
Yes, sir. Thank you very much.
All right, lead resources tracker.
Yes. Do we have sharing capabilities, Wendy?
I think Wendy has that.
I
Wendy,
believe, yeah, you can share. What was that, Fred?
The lead resource tracker, do you have that?
I thought she has a copy of that.
The lead
Resource tracker.
Wes sent it, I think.
Oh, I'm not sure if they have the most up-to-date one. I mean, I
Oh,
can share
okay.
my screen, so.
I thought we already. Are you talking about the legislation?
No. We're doing a lead resources tracker, a comprehensive map of all the lead resources in the state. We just wanted to present it to the commission to share what we're doing so far.
Yeah, I don't think I do have, I don't think I have that, but you should have sharing capabilities.
Yep,
Yep,
should
there
be
you go.
sharing it.
Yep.
There you go. Okay, so I'm going to share first, and then I'm going to stop my screen and then give it over to Bea so she can show you guys the map. But just for some context here, and FYI, this is Shadia from GHHI, Outreach and Education Manager. Just for some context, we've been working with MDE and MDH to kind of create this kind of comprehensive, holistic resource guide that is both client-facing, but also that local health departments can utilize, CBOs, nonprofit organizations, et cetera, to share out with clients with all the different resources in the state when it comes to lead, asthma, healthy housing, general housing support, and hazards in the home. Now, specifically, this one is for lead. So what we've done is kind of done some preliminary research on all of the national, statewide, and specific jurisdiction or municipality resources that are available for lead resources in the state. So they are kind of organized by type right now, but we also have them organized by national, statewide jurisdiction and cities and municipalities. So what we want to do with this spreadsheet is to ensure that it takes you directly to the page that gives all the information, but it also lists the target audience, the eligibility, a comprehensive description, the type of service, the due date if it's applicable, the address, and different addresses, different contact information, different contact people, and emails. Because what we've realized is there's a lot of resources available. However, it is very difficult to access. They're in a bunch of different places. And while DHCD on their website, especially for the home repair program, has all the numbers for each county or each jurisdiction to get those resources, each one of those numbers is associated with a community-based organization or a housing community development department in that specific jurisdiction. So it's imperative that we actually do some productive outreach. We call them and we say, hey, do you actually have this program? And what are the program eligibility? How much money do you have? When is it due? Et cetera. So that is what we've been working on. So what we'll do is we can share this out with you guys. Right now, we only have up to Calvert County in terms of type of resource. However, we have them all complete when we move over to jurisdictions if it would let me, but it's not right now.
Send it to Barb.
Okay, I'll send it to Barb. But yeah, it is not working with me right now, but we do have over like 100 resources in the state. So what I'm going to do is stop my share and I'm going to show you, Bea is going to show you guys the interactive portion of this because what it does is take all of these resources and put them on a map so that we can put on a website. So you can just click your county, click your jurisdiction and find the available resources that apply. So Bea, I'm going to stop my share and you can go ahead and take over.
Why didn't you do this 3 years ago?
Well, I just got here, so it's been a year and a half.
While you guys are transitioning, there was a question Barbara Moore asked if there are interpreter services available for the.
So the goal with the holistic resource guide, ideally we will have it translated. However, right now it is just preliminary, but we can work further on that and talk to you offline about that, Barbara.
Yeah, actually, what I was wondering is on your spreadsheet, would you be able to add if the agency has interpreter services available?
Absolutely. Absolutely can do that. Thank you. That's a great note to have. Yeah. Thank you.
Okay, so I'll just quickly show you guys what I've been working on for the mapping component. And so, like Shadia said, this will, once we've finalized and vetted all of the resources that we have on the spreadsheet that Shadia showed you, this will be populated with all of the most up-to-date information. But essentially, I've got a map here with all of Maryland's counties and a couple of the city and town jurisdictions as well. And so the vision is that you're able to click on your county and it will pop up with the resources available to you with just some like high level information about them. And then from there, you can click on each resource to get more detailed information and contact information for each of the resources available. And then also, like, if you're not sure which county you live in, but you know your address, for example, I'll show you just where the GHHI office is. You can also search your address and it will take you to that point on the map. And then from there, you should be able to click on your jurisdiction and it will pop up with all of the available resources. So once we finalized our complete list, this should be all set with the up-to-date info and hopefully an accessible way to be able to navigate the things available.
Yeah. So awesome.
It
This
is.
is amazing.
Yeah.
I have a question.
Yes.
Do you guys have a ETA on completion?
So the MDH resource guide is actually, the first draft is due March 30th, and we want to have it done by the end of this fiscal year, so June 30, 2026. However, I think it's going to be preliminary, so that way we can contact local health departments, state agencies to do some vetting to make sure everything is up to date and correct. But I mean, the information's there, we just got to make sure that it's accurate. So that's the biggest part right now. Go ahead, Dr. Mitchell.
Yeah, and I just want to give a huge shout out to the GHHI and the staff. This has been something that is something we talked about a number of months ago, and like magic, you just utter the words and it appears. But you know how much effort goes into this and making sure that the various parts are right. So, Fred, I think the whole goal of this is to have one place where all of this is collected. And I think, you know, part of the issue is thinking from a state agency point of view, where it will live and how it will be maintained after it's born, because it will need care, feeding, and sort of constant attention and nurturing. And I think we have to sort of figure out how that will work. And that's a conversation that obviously some of us will have to have.
Yeah, for sure.
It's good. Even just as a basis, it's invaluable. You can ask Barb, their social worker had to do so much for us. And it was
Any other questions, comments?
To your point, Dr. Mitchell, just want to say that is the goal with this, right? Is like that it's a live document that we can go in and edit at any time and it will automatically update. So there's no need to take it off, put it back on. So hopefully that will be an easy thing to do moving forward. But once it's done, completed, we can go from there. So thank you guys so much for the feedback. And we will, I'm not sure what the process will be in terms of sharing this out, maybe via the committees. But yeah, we will definitely need feedback on some of these resources. So just stay tuned from us.
Okay.
Thank you. Fred?
Yeah.
Yeah, so sorry, I have an 11 o'clock meeting I have to join, so that I think Theo Williams is on and can provide an update from us when that time comes.
Thanks, Doc. I actually skipped thriving communities. You guys want to do thriving communities as well?
Wes.
Oh, I got it. Thank you.
Okay.
Hey, sorry, I'm on the phone. But what we are doing is we will be opening a portal. As I said this in the last meeting, we'll be opening a portal for nonprofit organizations, and Maryland is included in that. But if commissioners know nonprofit organizations working on lead who need about $75,000 in operating resource support, please contact us, contact me, or contact Thriving Communities at ghhi.org. and we will walk you through the process of how to nominate organizations. That's pretty much it, but that is an open process at this point.
Ruthanne, is it open to apply now, or?
Yeah, we are going to be opening the portal, if not today, this week. But the team working on this, led by Andrea Brown, will be back to anyone who wants information on how to make referrals or the process in which we are doing this.
Thank you. Okay, hot topics, MDE. I think unless you guys have any specific questions for me, I think I've talked enough. I'll move on to MDH. Theo, if you have anything.
Yeah, I'm pleased to announce that the Association of State and Territorial Health Officials has awarded us an additional round of funding for this fiscal year. So this is funding that we give out to the 13 local health departments that don't participate in the home visiting program to support enhanced case management services. It's funding that's been around for, I'm not quite sure, I think going on 4 years now. I think 2022 is the first year, but please don't hold me to that. And we're pleased that, the CDC has been able to fund the association, or ASHTO as it's known, and they in turn have been able to continue to fund us. So we're very excited to be able to continue to support those enhanced case management services in those jurisdictions that, at least as of now, don't have home visiting services. And that's, I think, the only update we have.
Thank you. American Academy for Pediatrics, Dr. Niaski.
Thanks, Fred. And nothing new to add from our organization.
Thank you. MSDE, Office of Child Care.
Nothing more to add, sir. Thank you.
Maryland Insurance Administration. All right. DHCD, Nicola.
She had to drop off, but she said there are no updates for today.
Okay. Ms. Hart from Baltimore City.
That will be, is Nakia still
Yeah,
on?
I'm here.
Okay.
Good morning, everyone. We don't have any updates at this time. Thank you.
All right. Baltimore City Health Department, Brianna.
Good morning, everyone. No updates.
Baltimore Renters United, Nadia.
We already spoke about Safe Homes Now, but no additional updates.
And GHHI, anything additional you got?
Yeah, just real quick. We're gearing up for Public Health Awareness Week. I believe it's April 7th through the 13th, so stay tuned for events. We're probably going to do some property owner convening. So Adam Skolnick, check your email. Probably send you an email later today or tomorrow at the latest. And then we also have the Maryland Asthma Summit tentatively scheduled on May 14th. So be on the lookout. It hopefully will be at the University of Maryland College Park, but we will see because it's been a hefty price. So just stay tuned for that messaging, and we'll be sure to share out with all the agencies.
Okay. Any additional commissioner comments and updates? Susan?
Thank you, Fred. I hate to sound like a broken record, but when I was looking at the annual report to the governor's, the report itself, I go back in the meetings of the commission, and the thing that strikes me the most is that those things that are in the minutes from January 2025 are the concerns that we still are not dealing with today, March of 2026, such as, it's become critical with the lowering of the blood levels. I am, you can tell I'm Italian. My blood gets to boil. In terms of, I feel passionate about making sure we're identifying all sources of lead exposure. And we have asked, and I have asked, and other people have asked, for redacted environmental investigation reports from Baltimore City, from the Maryland Department of the Environment. And I'm starting to feel like it's something that just does not want to be shared by anybody with this commission. And I'm wondering why.
Okay, I'll respond on our end. The program has in the process, we're working on getting our 2024 annual report, surveillance report in there. In that report, and I believe in the last year's report, there's documents, there's data on alternate sources of lead. We haven't this year, but next year we hope to map that by county and by jurisdiction. I wasn't familiar that you asked. I know you asked Baltimore City for reports, Susan. I didn't know you asked us for redacted reports, but I have no issue with giving you those. But yeah, if the issue is alternative sources, the data is in the 2024 report. We hope to have that out in the next couple weeks.
It's not, you know what, Fred, it's kind of like there's rules out there. And as a private risk assessor, I'm asked to follow the regulations, and I'm just wondering if, in fact, the Maryland Department of the Environment, the Baltimore City Health Department, are they following the same regs that I am supposed to be following as a risk assessor? Because that's what I'm wondering.
So you're not exactly looking for the alternative
data. I'm looking for a redacted environmental investigation that looks at and does it according to the HUD guidelines, Chapter 16 of an environmental investigation. And you know, Fred, I don't mean to put you in a pickle, because I feel to some extent that, you know, you're in you're just one person, you're one cog. And I mean, I think it's been an issue that's been ongoing, you know, with different government organizations. And I understand it's hard for people in government positions to kind of stay abreast or to continue at the pace of the private sector. But, you know, I just think it would be so helpful if we could see environmental investigation reports to make sure that we are pinpointing the true source of exposures to lead. And I do understand where, you know, oftentimes, if not most of the times, it is lead paint that is contributing to lead dust, but it's not all the time. And I think it would just be fair to all parties if, you know, everybody was following the same procedures.
So
and I thank you for that. Yeah.
I'll reiterate the fact that, Ruthanne, I remember you asking for Baltimore City reports. I didn't understand why. I understand what you're looking for now. If you send me an email, I'll make sure you have them by the end of the week. You want 5? Is that enough?
Yeah, that's plenty, Fred. I really just want them shared with the commission. I don't want them personally. I just think that it would be good to be able to, you know, to look at them so that everybody kind of understands the whole picture. Yeah, I just think that we need to move beyond where we are. And one of the ways is to, you know, have a level playing field, and to, you know, make sure what we're doing is enough.
Right. But just to be clear, Ruthanne, I think one of the things that would be helpful for us is if you put in the email the question of what you're looking for. And if you want me to share it with the commission, I'll share it with the commission. But ultimately, we're looking for, you know, generally these things go through a PIA request. But it's fine if you ask for it, we share it with the commission. Just put it in the email so that we understand what you're looking for, so we can give you the correct information.
Okay, and then I mean,
we got that, but if you're looking for protocol, making sure.
Yeah, I mean, look, I could do risk assessments, but they're you know, they're pretty restrictive in terms of how they're done. And I think there's a lot of private risk assessors who do them without doing them according to the HUD guidelines. I mean, I'm a rule follower. I don't do it because it's an expensive procedure to follow. And I just kind of want to make sure that there's a level playing field out there, and that if the regulations are meant to be followed, then everybody should be following them.
Right. And
including government
Susan, hold on one second.
Okay.
I want to make sure that these questions are relative to the commission and not just Susan. You know, and I know you can reach out to me anytime. We've met.
Yeah, thank you. Yeah. But I do think that, you know, it goes back to the, you know, I'm pretty passionate about cleaning. You know, I think that, you know, to look at and to see on an environmental investigation for commission members to see, you know, is that not involved in the questionnaire of HUD Chapter 16, and to kind of give us some data about the cleanliness of, you know, places. And I don't mean to be, you know, this is not a concern for any socioeconomic group of people, because I have clients who are well-to-do people who I go in to do dust sampling for on a regular basis. And I mean, they have high levels of lead, even though they are cleaning, but the only thing they can do, and the only thing I actually recommend to them is cleaning, because the paint is in good condition. So it's not just about tenants. It's about owner-occupied people. It's certainly, I'm not sure who mentioned it, but it is the education about what to do. And I mean, I think one of the first things that Green and Healthy Homes do with tenants is they give them cleaning kits. So to say that cleaning is not an important aspect of as a lead hazard control, I think is a disservice.
Okay, the department didn't say that.
No, the department, no, I know the department did not say that. No, not at all. No, if I construed that, I did not mean to.
All right, Adam, you have something?
Yeah, I mean, I would love to see those redacted reports as well, so it's not just Sue. And second, I mean, could you please include one where you guys can't recognize what the source is? Because I'll be honest with you, those are the ones that concern me the most, right?
Okay.
And I would argue that everybody on this commission, you know, as we all know, the number one thing is to try and have 0 children have, you know, elevated blood levels. And when the department can identify the source, I don't know how. I mean, we're not really helping those kids, and that's heartbreaking, literally heartbreaking. So I think it's important that at least one of those be where you guys couldn't figure out what the source was. Thank you.
Thank you. All right, any other reports from them, or any other updates from the commissioners?
Yes.
I'll open up to public comment now. I know we had some
Yeah, we have
questions.
lots of questions from Patrick Connor. I did compile all the questions into one sheet. Do you want me to go through them individually, or do you want me to send them to you for answering later? We have about 20 minutes left before 11:30.
Mr. Banks, Dr. Banks, actually, is it okay if we just walk through them quickly? If I'm the only, I don't want to take everybody's time. I think they can be answered fairly directly.
Okay.
So my first question, I'm already satisfied. It sounds like the draft report is going to be reviewed by the commission, and I look forward to it being finalized in the future. Second question, this is really related to old business. What's the status of the department providing that index of prior invalidated inspection certificates and their compliance date? So specifically, it was discussed American Homeowner Services, Green Environmental after the court ended. And I saw another one, this Walker Inspection Company. And there are other firms that in the last 3 years, the department has invalidated, depending on numbers that are published, but there's upwards of 10,000 inspection certificates that were invalidated. What's the status of those property owners coming into compliance after being notified that they were not in compliance? And I'm not asking for a report, but I'm just wondering when the report will be available and published.
Well, that's a good question. I'm not sure. I'll get with my guys to see. That's something that we traditionally do, because I don't think we've ever done that before, not since I've been here. But I'll look into that, Mr. Connor, and I'll get back to you with an answer on that. But we have no problem sharing that information. We're working on green now, reporting to the secretary on compliance. I'll tell you just regarding that specific case, of the 1,300 certificates that were invalidated, approximately 1,400, 900 have already been re-inspected. So we think that's a fairly good number. We're still working through the other 400 or so to get them in compliance. But I'll look at those other cases and I'll get a report back to the commission, hopefully by the next meeting.
Thank you, Dr. Banks. Second question, and this is more current, as been discussed at the commission, and I'm just more curious about reality now, is in January of this year, 2026, the standard for dust lead hazard changed dramatically. And every commission meeting that I've attended, there's been discussion about the damage caused by dust lead, regardless of source, dust lead. January of this year, the definition of dust lead hazard changed. And what I'm curious about is, can, at a future date, obviously, but can Baltimore City Health Department, the Baltimore City, State of Maryland, Housing and Community Development, and any other member organization of the commission tell us how they're handling the new dust lead standards following the investment of federal and state monies in lead treatments?
So I'll answer on behalf of MDE. We're in the process of updating our regs. Currently, we hope to have that out of the office and processed by the end of the year in preparation. We're due January 12th of 2027. So we hope to get our regs updated to reflect the federal standard by then.
Okay. And then I was more curious is what's happening right now with those using federal dollars and how they're communicating to the property owner that while they passed clearance, the action level, that they actually need to change their educational materials, their disclosure forms, and inform the occupant or to-be occupant that they're living in or moving into a dust lead hazard.
Yeah, that's a great question. Yeah. You got some, Paul?
No. Are they, I just feel like for the interest of time, we should, there's, if he has these kinds of questions for the department to answer, he should put them in writing. Because I just don't think that if the commission shares these feelings, I think they should have exercised them. These are specific from Mr. Connor. That
no, they're not. With all due respect, is this Paul Montgomery? Okay. My question is not Patrick Connor related.
Okay.
It's related to federal law.
Okay.
It's related to
asking on behalf of.
Okay. Then I will pause and maybe next meeting the representative of lead hazard inspection professionals can pose the question.
That's fine. You can do that.
Okay.
But for the interest of time, I just really feel like that, if these are concerns that the commission chairs and would like to bring up, then we do so and make it an agenda item for another meeting.
Okay, Susan.
Thank you, Fred and Paula. But I do agree with Patrick on this one wholeheartedly. And I think that Barbara Moore also does agree with that. She just put that in the text. Because one of the things that is really becoming an issue too is the fact that while you're going to be changing the regs, Fred, and because we have this risk reduction, which does not exist under the definition of abatement under the federal level, it's really going to cause confusion. It's already confusing. I mean, people don't don't always get the rules as it is already, and now we're going to complicate them even further by saying, oh yeah, you passed the dust samples for risk reduction, but you have a hazard according to EPA. I absolutely think and would like to make a motion that this become a part of next month's agenda.
Are you making a motion, Susan?
I am making a, thank you, Fred. Yes, I'm making a motion. Thank you.
I'll second that motion. Though.
Thank you.
Yeah,
Okay.
I mean, listen, I agree. I'm sorry. I agree that we should be talking about this. I think what I would love to see is let's put this in writing like today or tomorrow and send it to the department, and then they can be prepared with answers for the next commission meeting.
Okay, that sounds good, Adam. Thank you. Mr. Connor, you want to send, I think, Wendy, did you copy those questions off the chat?
Yes, I did. I have them in a document, the ones that Patrick submitted in the chat.
Okay. All right.
Would you like me to email them to you?
Yes, please. Thank you.
Okay.
All right, Mr. Connor, you got another question you want to pose?
Let's see. No, as a matter of fact, the last two were really related to the commission report, which I now know I'll see sometime, next quarter. So that's really it. And lastly, so I'll talk to Commissioner Kleinhammer about the scope of
federal.
Yeah, because I think it involves clearly Baltimore City Health Department and Housing and Community Development. All their work after January 12th of this year is federal, if it's federally funded, has a double standard. And I'm just, again, I am, as an interested party, I'm just interested how we're handling lead hazards after abatement.
Gotcha. Okay. Wes.
Thanks, Fred. I just wanted to make one comment. We've talked a lot about, alternative sources. We've talked a lot about other, things to focus on, but I think being in this work for, 30 years or more, I do want to remind the commission, put it before, that lead paint is still the primary source, the primary pathway, and that has to be the focus of our policy strategies and resources, primarily implementing other directives and things to address other sources. But just, I think that's important for us all to remind where we allocate our people, our resources to that primary goal. So I appreciate it. Thanks.
Gotcha. All right. Any other comments from the public? Update? Thank you very much. Next meeting is April 2nd, 9:30. Information should be going out to the commissioners prior to then. I want to thank you all for attending this meeting and appreciate all your support. Have a great afternoon.